Tandisai.
Thank you very much, Mr. Efford, and it is a pleasure indeed to serve under your chairmanship. My thanks also to the Honourable Member for Waveney and my honourable friend, the member for Bradford South, for securing this important debate, and to the Backbench Business Committee for ensuring valuable parliamentary time is dedicated to this issue. I'd like to place on record my gratitude to nurses, dentists, technicians, hygienists, and all those who have worked in dental practices across our country, but in particular in my Slough constituency over the pandemic, continuing to serve people throughout such uncertainty and disruption as best they could. As members today know, whilst clinics were not shut for long, the ongoing repercussions nearly 2 years later have been astronomical, with an estimated 38 million appointments missed during the pandemic. And despite best efforts, opening over 600 urgent dental hubs, staff working overtime on weekends and evenings, achieving a pre-pandemic level of service has certainly not returned for my Slough constituents, with nearly two-thirds of practices estimating that they are continuing to operate under 70% of their pre-COVID capacity. Mr. Efford, or should I say, Ms. Ali, returning back to so-called normal was never going to be straightforward, but the chronic lack of support for dentists now and prior to the pandemic is taking its toll. As honourable members have already eloquently highlighted, shockingly, government spending on NHS Dentistry has been decreased by more than a third in the last decade. Like many of our other health services, we cannot allow government to use COVID as a smokescreen for what was already a decimated profession. In the 5 years before the start of the pandemic, the number of practices providing NHS dentistry fell by 1,253. And in December 2021, a survey showed the true toll this has taken on dentists, with over 40% planning a change of career or retirement over the next year. Tory cuts have consequences, and the pandemic has revealed these drastically. Since the reopening of practices, I have been contacted by dentists concerned about meeting their targets without adequate support, and patients waiting months and sometimes years to be seen. This long-term lack of support has created a double-edged sword, failing both patients and practitioners. So I welcome the government's recently announced funding, which I hope will achieve their aims of securing 350,000 extra dental appointments, particularly for more vulnerable groups. But as the only country within the United Kingdom which failed to provide support until now, I fear, Ms. Ali, this is too little, too late. Like with all catch-up plans, we need to listen to those who are impacted. Following this announcement, the British Dental Association noted that, and I quote, "After a decade of cuts, a cash-starved service risks being offered money that can't be spent. Hard-pressed practices are working against the clock, and many will struggle to find capacity ahead of April for this investment to make a difference." And I have seen this too from constituents contacting me. Over a year waiting list for an appointment within Slough. Orthodontist referrals from 2018. Patients being asked to go private if they wish to receive any treatment promptly, paying hundreds just to be pain-free. And this situation is sadly going to get worse, with over half of dentists stating that they are likely to reduce their NHS commitment. So overworked and undervalued. Ms. Ali, is this privatisation by stealth? The managed decline of Britain's public services, overseen and supervised by this Conservative government, has to stop, because we all know who will lose out if this continues. The most vulnerable in our society, particularly young people, and without truly addressing this now, we lay the path for a litany of future health issues for children and young people. And I know that in my Slough constituency, officially the youth capital of Britain, with the lowest average age of any town or city within our country, this will be devastating. In 2019, for example, 41.5% of 5-year-olds in Slough suffered from tooth decay, compared to the national average of 23%. Often required general anaesthetic to remove the impacted teeth, leading to other health risks and impacting their education through missing days from school. Even prior to the COVID pandemic, tooth decay was the #1 reason for hospital admissions among young people, with a year-long waiting list for this procedure as standard. And we know already the disproportionate impact the pandemic has had on certain groups: older people, people living in deprived areas, Black, Asian and minority ethnic groups, and the most vulnerable groups within our society. And sadly, this has extended into dentistry, with NHS England and the Office of the Chief Dental Officer highlighting that, and I quote, "Evidence suggests that existing health inequalities have been compounded by COVID-19, and the long-term economic impact of the pandemic is likely to further exacerbate oral health inequalities." So if dentistry moves forward towards either a privatised model or patients simply cannot be seen due to NHS demand, it widens and entrenches inequalities within our society. And in the long term, it doubles down pressure on the NHS for avoidable treatments. Our NHS dentistry should function according to the founding principles upon which it was created, being accessible for all, regardless of one's ability to pay.